Too much optimism about a vaccine. I'm Scott Ott, and this time on Bill Whittle Now, I talked to Bill about this new announcement from Pfizer that they have, in some testing, determined that they have a vaccine that's approximately 90% effective against COVID-19. Eli Lilly and other companies are also in the midst of multiple rounds of testing, and it looks fairly certain that by the end of the year, early administration of this vaccine will begin to happen with a wider rollout, perhaps by April of next year. All of that could go to the wind if anything changes. But Bill, the Wall Street Journal had a story where it outlined some of the challenges faced with trying to do the kinds of inoculation that we're about to embark on. If indeed the Pfizer vaccine, for example, is 90% effective, you still have to vaccinate something like 75% of the population, and in this case, of the world, of the population, in order to hope to develop the kind of herd immunity that you really need. As you see these stories coming out and, the stock market taking a jump when it hears this news, what are you thinking?
I'm thinking that the people who they're going to test this vaccine on would have died of old age if Donald Trump hadn't rushed all this stuff through. I'm thinking that the admission that a vaccine is available 5 days or 6 days after an election is remarkably good timing for the Democrats. And so I just think that needs to be said. When we watched this COVID pandemic going on, the one thing we saw immediately was Donald Trump slashing the red tape, that studies were being done in days that used to take months or years to approve. So if we get a vaccine in March or April, no doubt Joe Biden and Kamala Harris will be sure to credit Donald Trump for his cutting through government red tape in order to get that available and save American lives. As far as the rest of it goes, it is just like any other vaccine. The testing of this vaccine will be just like any other vaccine. But the response to this vaccine will not be like the response to any other vaccine, because the public health officials in the United States over the last 9 months of 2 weeks to flatten the curve have destroyed public trust in them to basically to 100%, at least to 100% of the people who of the 70 million people who voted for Donald Trump. They have destroyed their credibility, and they've destroyed their credibility by allowing the press to whore them around in order to keep people afraid.
So it sounds like you're suggesting that there may be a large number of people that would prevent us from getting to such a 75% threshold. And by the way, if the vaccine's only 80% effective instead of 90%, it means that you have to vaccinate virtually everybody. The big challenge here is going to be that there are a bunch of people who feel just as you expressed there, the great skepticism against public health officials based on the last 9 months, who will simply refuse to get it, in which case our government and the governments of the world will have wasted multiple billions of dollars trying to accomplish something that can't be accomplished because they'll never get to the threshold that would provide that so-called herd immunity.
We're talking about two separate things here, and I think in the years to come, we're going to find ourselves thinking a lot more along these lines. If I understand my vaccines correctly, when you talk about needing 80% or 75% or 90% of the population in order to achieve herd immunity, that basically means that that's the number of people who have to be vaccinated so that the virus can no longer spread from one person to another because the gaps between the fuel are too big. That doesn't mean
it's like
that
those
one
fire
person
breaks you've talked about in the past.
Yes, exactly. If you've got a California hillside filled with burning brush, it goes up like that. If you take half of the brushes out, it burns slower. There comes a point where you take enough of the brushes out off the hill. You just plain remove them so that the few brushes that are left can't have this fire spread from one to another. One can occasionally catch another, but the whole hill's not going to go up. But what I understand about the vaccines is that is a societal benefit. The personal benefit applies to you directly. And this is what I mean by thinking about things in the future. We are 50% of the population. We don't know what's going to happen yet in the courts and so on, but certainly significant numbers of people have voted to have their cities burned down and to defund the police and so on. And that's their right as Americans to vote for that stuff. Herd immunity is most important in places like cities where people are closely packed together. I'm going to assume for the moment, and I don't see any reason not to assume this, frankly. I'm going to assume for the moment that the vaccine is safe and effective. If the vaccine is safe and effective and you inoculate yourself and your family, then you're fine. You're fine. Your family's fine. Nothing can happen to you as far as COVID-19 is concerned, assuming that the vaccine is reliable, safe, and effective. So when you talk about we need to get to this percent or that percent, depending on how you look at it, if this vaccine is safe and effective, and I'm vaccinated, my family's vaccinated, I don't give a flying damn what happens to the rest of the world. That's one way to look at it. And
if what you say is true, though, Bill, it would seem to me that the people most at risk under such a scenario are the people, as you characterize them, as Trump supporters, essentially, the 70 million people who voted for the president who have that great degree of skepticism. All the Democrats, like they did the mail-in ballots, will march in lockstep and take the vaccine and be protected. Meanwhile, the people that you're counting on to sustain this republic into the future will be dropping like flies.
Well, that would be true if it weren't for the fact that they're not dropping like flies. You see, that's where your argument falls apart. It's the dropping like flies part where the argument falls apart. And this is why my attitude towards this vaccine and this outbreak, this pandemic, is different than it would be if it were yellow fever or something that was serious. When you get down to the actual numbers, and of all the malfeasance and voter fraud that went on in this country, the failure of the press to report these numbers is second only to their failure to report on Joe Biden's mental health. But the CDC issued a report a month and a half ago, 2 months ago, saying that of all the people that died of COVID-19, 94% of them had 2.6 comorbidities, meaning they were either 2.6, not just one. In other words, they didn't just have heart disease or late stage heart disease or emphysema, or obesity. They had late-stage heart disease and emphysema and obesity. 2.6 is more than 2.5.
You know, Bill, now, you've said that many times, and let me just ask you, though, how many people do you think are walking around right now in the population who have not yet died from COVID-19 who have 2.6 comorbidities already?
My point is this. The entire economy was shut down, and the election was heavily influenced by the constant screeching about the death toll. When the death toll includes, when the Center for Disease Control says that the number of people who died from COVID-19 only, and this is what we're talking about now, the actual number is probably around 9,000, somewhere in that ballpark, maybe 10, 11,000, which is about a quarter of the annual flu. We're very lucky in one sense, and in fact, we were too lucky, I suppose, although I don't want to say that. This is an unusual virus. It doesn't seem to affect children at all. I mean, the nearest whole number to the number of children, percentage of children under the age of 10 or 12 infected by this virus and who die of complications of it, nearest whole number is zero by far. And so unlike the influenza pandemic of 1918 and 19, which took out people at the peak of their health, this virus appears, what am I saying appears? This virus has essentially zero effect on young, healthy people and doesn't really begin to get any traction until you're in your 50s. Once you get into your 50s, you start to see mortality rates more or less double every decade. So round numbers, whatever the percentage is at 50, it's double that at 60, and it's double that at 70, and so on and so on and so on. But the reason for this is that as you get older, you get other comorbidities as well. And if we were to follow the science instead of the scientists, we would realize that all we are really concerned about from a sheer societal perspective is what percentage of people are dying as a result of COVID-19 only. That's not to say, for an instant, I have people who are in that high-risk group. I have a lot of people in my life who are in that high-risk group. I'm not saying we just simply cast those people away, needless to say. But what I am saying is this, is that the entire strategy has been utterly unscientific and ridiculous. And furthermore, that the entire media treatment of COVID-19 has been nothing but a 9-month-long scare campaign. And you don't have to take my word for it. I think the person who we can trust the most on this is Elon Musk. And the reason I keep coming back to the example of Elon Musk is not because Elon Musk opened his Tesla factory just because he wanted to. Elon Musk tweeted the actual data in terms of the number of people who are hospitalized for COVID-19. Here's Newsom's projection for April 1st. Here's his projection for the 15th. Here's his projection for the 20th. And here's the total number of people who are actually in hospital beds. And he said, this is insane. We were told that we need to flatten the curve. The curve is not only flattened, it's flat. So we would like to get back to work. The state said no. So he's moving to Texas like every other normal, sane person is.
I think he's moving a lot of his operations to Texas. I saw a story recently that indicated that he himself may not be moving to Texas.
He can live anywhere he wants to, but
right.
I assure you his permanent residence will be in Texas.
His permanent residence will be on Mars. But in any case, this let me wrap this up with this question, because just loosely based on what you just said, let's say the vast majority of the Democrats take the vaccine. Let's say that the bare majority of Republicans take it, but a significant minority of Republicans do not. Let's say that the federal government requires anybody who lives in a nursing home to take it, because most of those folks are living on government insurance, and they could be forced to take that. All of this, according to the story in the Wall Street Journal that I read, the doctors are basically saying, hey, people, just because a vaccine's coming down the pike doesn't mean your life is suddenly going to get back to normal. In fact, it's probably going to be something like mid-2021 before we even get significant uptake on people taking the vaccine. And we're probably looking at 2022 before we can start relaxing things like mask mandates and social distancing and not being able to watch a decent college football game in a stadium anymore. Bill, what is your sense of how long we can go on living like we were in the smoggiest city in communist China?
If you'd asked me this question on November 2nd, I would have said not much longer, but clearly I'm wrong about that. I had an interesting and animated discussion with my wife about this morning. She was talking about when the vaccine comes online, or a vaccine comes online, and things go back to normal. And I told them they will never go back to normal. Not in California, anyway. The idea of people walking around wearing blue masks is a sign of submission to them. And they are quite enamored with it. And so I guess what I'm going to say is that, like it or not, whether you take the vaccine or not, you're going to have to risk going out there into a world where the specter of death is waiting on every corner, and your chance of getting past the bony figure with the scythe in his hand is a mere 99.96%. I suppose it's the end of the republic as we know it.
But there'll be places, my full-time employer, Bill, my other full-time employer, they require that. If I decided suddenly that I want to exercise my liberty, it is my way of saying I no longer want a job here. And I think a lot of employers are going to do the same thing.
That is their right. That is their right as a private company. They can do whatever they want to. And as a private company, they're undoubtedly trying to minimize the total number of exposures. And I'm not unsympathetic to this. I'm really not. If there was a way to do both of these things, I'd be very happy, but there isn't. So sooner or later, it may not be true for your current employer. Your current employer is a larger company. But every time I drive home, I see businesses boarded up, and they're never coming back, ever. And they're never coming back because the people who are frequenting them, like the young people that you normally see on Ventura Boulevard, their chance of surviving COVID-19, assuming they catch it, and the percentage of the population that generally catches an airborne influenza virus hovers around 20 to 30%. So first of all, you have to be in the 20 or 30% to catch it. But if you do, and you're in the age of the people that I see walking on the streets, your chance of surviving COVID-19 is down to 99.993% or something along those lines. So here's the issue, Scott. It's a very simple issue. We have, when I say we, I mean certain elements of this population, have become so risk averse and so terrified and so utterly convinced that they are entitled to live to 120 years old and die peacefully in their sleep, and anything other than that is a rank injustice, that they are willing to put up with anything. I see it every day here in California. I see it every single day. I see people who are willing to put up with anything, so long as the people in charge tell them that if they don't do these things, they may get sick and die. They're capable of reading statistics as well as I am. Their internet goes for the Center of Disease Control just as easily as mine does. But for me, I decided that I'm going to take the risk and just swing for the fences and hope that my 0.02% doesn't come up. But if it does come up, that's okay too. because I would rather live my life with a risk of this pandemic or any other pandemic than lock myself in a room and never get to see the face of the people I love, never get to touch them, never get to hug them, never go to a football game again, never go to a party, never go to a beach, never have a kids go into the prom. All of that's gone because you have a 0.01% chance of dying if you should catch this disease. I find that to be not worth the price. And it isn't worth the price. And in any sane society or any sane planet, we know it's not worth the price. And the reason that this has gone on as long as it has gone on is because Western politicians are responding to a population that is so unbelievably affluent and so unbelievably healthy as a result of scientific advances that they believe they have a right to live forever and never, ever get sick from any reason whatsoever. And furthermore, they are all represented by governments that look upon this as a godsend. And that's no question what the Democrats saw this as. This is a gift. Well, since they're Satanists, it's a gift from Satan himself. For them, it is a chance for them to use people's natural, not just aversion or fear. I mean, I was afraid of this thing when it first came out because I didn't know what the mortality was. It's perfectly normal, and it's not only normal, it's smart and sane to be afraid of a new pandemic that the Chinese Communist Party unleashed on the world. That's a good thing to be afraid of until the actual data comes in. And the actual data started coming in by the end of April. The data was in. By the end of April, Comfort had sailed out of New York Harbor and Hope had sailed out of LA Harbor, or the other way around, I forget which. And they'd gone home because there weren't enough customers. And as Elon Musk points out, the hospital bed load was below what it was normally. That's data. That's not a projection anymore. That's data. And when we saw that data, we should have responded to it, but we didn't. And that tells me that this is not about COVID-19, and it's not about the virus, and it's not about infections, and it's not about saving lives. It's about political weapon. And the proof that I'm right is that the only two times that large amounts of people have ever been able to congregate and be immune from the effects of this virus is if you're marching for a Black Lives Matter protest, or if you're packed shoulder to shoulder celebrating Joe Biden's apparent win, which is, I'm not even going to say that, Joe Biden's celebrating the media's coronation of Joe Biden, which remains to be seen whether or not it'll be true. 10,000 people shoulder to shoulder outside the White House, everybody celebrating. And actually, honestly, truthfully, at that exact same instant, about a mile or two away, sorry, no, this would be in New York, come to think of it, individual policemen are writing citations to individual business owners, primarily Jewish business owners, on the instructions of Bill de Blasio, and trying to shut them down for having one person in their store with a mask 6 feet away. So draw your own conclusions. But what I find is that the people who live in California, the people that voted for Joe Biden, are not people who believe in the science, because the science is right there. They believe in scientists. And what they mean by that really is they believe in authority. They believe in authority. And if someone in authority tells them that it's true, then it's true. And if a computer spits it out, then that's even better. And I just am not one of those people. I never have been. And I know for a certain fact that 70 or 80 million other Americans aren't built that way. We would rather live our lives, take reasonable precautions. And it's the same thing as going outside. You're safer indoors. That's why this California, or at least the LA program, I thought was the ultimate in Orwellian public relations. Really. It wasn't, we're locking you up. And it wasn't, we're telling you to do so despite the fact that there's no laws backing us up. It was, you're safer at home. And you know what? They're right. They're right. You are safer at home. And if you're one of those people who thinks that it's better to never leave your house in order to maximize your safety, then I have a genuine, honest pathos towards you. I feel sorry for you in a way that you can't imagine. That must be the most horrible way to live life imaginable, but I see it every day, so I guess I'm getting used to it.
The members of BillWhittle.com have made this program possible, along with some 40 programs every month. Their growing ranks engage in vigorous discussion and a lot of entertaining humor at the member blog, as well as in the comment section that you can access when you go to BillWhittle.com and click that big green Become a Member button. For Bill Whittle, I'm Scott Ott. Thanks for watching.